Sabah Hospital Specialty Units Manager Dr. Adil Al-Asfour attended the ceremony at Zain Hospital to honor Dr. Abdulmohsen Al-Terki, a Kuwait consultant in Otolaryngology, head and neck surgery at the Ministry of Health and the Chairman of ENT faculty at Kuwait Institute of Medical Specialization, KIMS. Here is more on the issue in this report with Salim Al-Kendari.
Obstructive sleep apnea can affect up to 4% of the population, which is as prevalent as asthma, but it is not easily diagnosed if compared with other sicknesses.
Obstructive sleep apnea is a very prevalent disease, but the problem is that it's not really diagnosed in a way that we can really talk and treat. For example, it's not like asthma. Asthma, when a patient has an asthmatic attack, which is also prevalent as 4% in the population. An asthma attack means you have to go to emergency, it means you have to take a nebulizer, do all these things. The problem with obstructive sleep apnea, which is also 4%, is that 80% of people who have it don't know they have it. And that's the problem with it. The issue is when you have this problem, you have to have a guideline where to go, how to do it, how to treat it. Now, the number one is diagnosis. Number one, diagnosis. So how do you diagnose a patient with sleep apnea? First of all, there's a questionnaire you ask. Usually it's the husband, the wife, the son, the daughter. When you do that, then there is a part of the patency, there is a category that you have to go through. For example, there's something we call sleep study, which is a test that you can do it at home or in the hospital that measures your oxygen saturation, measures your pulse rate, and how many times that you have apnea. When we talk about apnea, apnea basically is a complete cessation of your breathing while you're asleep. And that could happen 100 times, and let's say if you sleep 8 hours a day. Snoring is basically a partial obstruction in the airway. So, when you're tired, let's say you had a big supper, or, you were exhausted, you just came from a flight, everybody snores. But now when you go on snoring 24/7, all day, and the wife is complaining, then there's a problem. The issue with that is that we need to diagnose and to treat in a way that it can affect the patient on the long run. Now, the problem with the apnea also, again, as I said, it's not like asthma, because apnea, the issue with it is that it causes heart attacks, it causes stroke, it causes diabetes, sexual dysfunction, lack of concentration, lack of the patient start losing language. For kids also it can be seen. Now, when you do all these things and diagnose it, then it'll be easy to treat.
The most important part of the patency was adopting a global standard for doctors working with patients diagnosed with obstructive sleep apnea, and to help them solve the problem and provide better treatment. From Zain Hospital, this is Salim Al-Kendari reporting for the English News.